Welcome, everyone. I'm Barbara Kaufman, COO at Newark Regional Business Partnership, and I wanted to welcome you all to our webinar this morning. This is the second installment of our four-part Return to Work series, and today we're going to be hearing from our member EMLCOT on providing a safe workplace and being able to come back to the office safely for both employer and employee. Just wanted to welcome everyone, and for those of you who are new to our webinars and our events in general, just wanted to encourage you to invite others from your organization to join us for our webinars, and when we are able to come back and meet in person, to come out for our events and get involved with NRBP. If your company is not yet a member or you're not sure about it, you can always contact me or anyone on the NRBP team regarding that, and we'd be happy to help you. We have two more webinars in this series coming up. Next Monday, we will be talking about space considerations and how you might need to reorganize the seating in your office if you have people who are too close together or not social distance apart. We do know that some of our members have access to screens, and some offices are proactively installing screens in their offices to be able to keep their employees protected. So that if you're interested in that, that's something that we can share with you as well. And also we have members who have PPE supplies and also have cleaning materials and different things that may be helpful to you as you come back to the office. On Wednesday, we'll have our final session, and we're going to be looking at the health and mental health aspects, the physical and emotional health. And we'll be hearing from Rutgers Biomedical and Health Sciences and from Quest Diagnostics on the status of testing, whether it be for antibodies or for the virus itself, what's the protocol for taking temperatures, what sorts of other things are needed. And then also we'll be hearing from mental health experts on some of the concerns that people have surrounding this now lengthy isolation and what that means for people, how to help people as they come back to the workforce if there's fear, being able to accommodate the needs of various people. Our first installment was Monday. Some of you were joining us for that. That was on legal. Chip Halleck, our president, is going to be closing, and he will be giving reminders, but I'll also mention that on Thursday, we are essentially full for our 1 o'clock Newark Nexus, which are small group conversations for networking purposes and being able to connect. And we're having our second happy hour on Thursday at 5 p.m. And we'll be welcoming Dan Palsy, who's the chef of Red's Beer Garden, to talk about some German beers and pairing of German foods with German beers. On May 14th, our guest is going to be DJ Lucatelli, who is the owner of Sweetwater Coffee and Tea, and he will be showing us a coffee drink. So we hope you will join us for that, and we'll also be announcing some other programs for next week. With that, I am going to go off camera while our presenter, Bruce Groves, who is president and CEO of EMLCOT, gives us his comments, and then I'll be coming back to field your questions. You will see that there is a questions box. Please use that questions box to pose whatever questions you have, and I will direct the questions to Bruce after he concludes his presentation. So with that, Bruce, welcome, and thank you for presenting today.
Thank you. Thank you, Barbara. And good morning to everybody. I just want to give a quick intro to EMLCOT and to myself. EMLCOT is an environmental health and safety consulting firm. Our core competency is dealing with exposures, exposure assessments, getting people comfortable, protected in the workplace, and we clearly have quite a bit of experience dealing with chemicals and physical hazards as well as infectious agents. So this is an area that we're comfortable in, and the presentation, my background is I've worked at Umpire for almost 30 years. We have 50 people here in New Jersey. We have a New Jersey base. We also, my background goes back as an ocean inspector when I got out of college, so I understand the regulatory aspects and a few other jobs with some manufacturing, some mining companies before that. The purpose of this and kind of the theme that I'm going to talk about in this presentation is the importance of taking the pivot from what has been a lockdown where everyone has to kind of shelter in place at the same level. I call it a carpet bombing approach, where you make it very important that people take draconian steps in order to determine how bad this virus is going to be, not to overwhelm the healthcare system, et cetera. But now we're pivoting, and we got to get people out of the house, and we got to get the economy moving. And so I'm going to talk about the process of doing that, and I'm going to take a risk-based approach. Currently, I'm working with the legislature in New Jersey, some of the folks there to put together a plan, a risk assessment plan, in order to trigger when is it safe to go back to work. And I'm going to talk a little bit about that during the presentation. The first slide I have here, the first slide is talking about the goals of the current crisis that we're in. And the first two goals, I think everyone's pretty much aware that the big push of flattening the curve, which everybody understands what that means now, is to not overwhelm the healthcare system. And that was very important. There's going to be a lot of talk about, getting a more robust healthcare system, emergency response system. So they're not going to be as ill prepared in many ways as they are. But regardless, we needed to buy time to not overwhelm the healthcare system. We also want to keep people safe. The third one was kind of ignored during the first part, and that's to keep people working and the economy moving. So my pitch here is these do not have to be conflicting goals. We can still get people working, get the moving, get people return to work, and still meet the first two goals of not overwhelm the healthcare system and to keep people safe. This is a review for many, I'm sure, that we're dealing with a virus. Viruses, when you deal with COVID-19, it stands for coronavirus disease 19. It's not the name of the virus, but that's for we folks that want to kind of distinguish between the virus and the disease itself. And viruses really are not a living organism. It's a protein molecule with a protective layer of fat, and that layer of fat is about a cell thick, and that's important when you start dealing with disinfection, when you start dealing with cleaning, and these viruses typically can sustain themselves for some time in the environment, but when you deal with all sorts of things like UV light or detergents, they can be neutralized pretty quickly. Now, the first stage here is risk communication. The message that everyone has heard in the last 6-8 weeks is we're in a crisis. We need to have a radical change. We wanted to make sure we get all the kids off the beach. We want to make sure that people aren't going to put themselves at risk. And the first step is to make this that everything is a universally high risk. And you've heard that issue from the infectious disease doctors, Dr. Fauci, epidemiologists, and of course the politicians, our governor of New York, and other governors and legislatures, and they are basically saying you have to shelter in place, you have to wear masks, and so on. The second stage of risk communication is post-crisis. And this is where we want to define, when is the crisis over? Well, it's still going on in many ways, but we have to kind of put put a stake in the sand at this point and saying, let's declare this a post-crisis. We still have to protect ourselves, but we need to get back to business. And this is where the dialogue basically starts to have to be dominated, not by doctors who are concerned about the crisis associated with treating sick people, but with industrial hygienists, which is what I am, and toxicologists, which we have many toxicologists out there that basically say that there is a risk, but it's a risk that can be quantified. There's a risk that could be relative. We also need to have a post-crisis message from business leadership. And you're starting to see business leaders that are saying, yes, we can safely come back to work. And then the politicians have to also kind of change their view from the first crisis, the radical change in behavior, to the second post-crisis, which is to get back to business. Now, when we're talking about cohorts are groups, okay? I could say groups of people. We take a risk management approach, and you got two different cohorts, and both of them are critical for business. The first are the workers. I've made a career out of identifying hazards and putting together programs and procedures to protect workers on site and to inform them, to train them, to make sure that they can do whatever job they're doing and do it safely. The workers are not, the difference between workers and the public is that you're dealing with people typically 18 years old to 65 years old, plus or minus, tend to be healthier people. Public, you can deal with the very old, the very young, people of all sorts of different pre-existing conditions. So there's a whole different perspective when you start looking at public and the workers. One of the things that has been missing in this whole process is the discussion on dose. And I wanted to give a little primer on what is dose and why it's important when we start determining how to get back to work and how to basically manage the risk. And the concept of dose is very simple in that if you are exposed to something that's very small from a quantity standpoint, then your negative effect, either how your body reacts adversely or disease, is going to be much less. As that exposure increases, then the dose increases, and you do get a much more significant reaction of a person, of a body. So the classic dose, you can use alcohol as a dose. Obviously, everyone understands that if you have one beer, you can drive your car an hour later, and you're not going to be impaired. You have many beers or many drinks, and it has a much more adverse effect on your ability to react, and you have a much more adverse effect, and you cannot operate a vehicle. So that's kind of a dose curve, and this dose curve follows not just chemicals, not just drugs, but it also follows when you start dealing with infectious disease, and that's a good thing because bacteria, viruses, they're everywhere. So if one virus elicits disease, we're all in big trouble, and that's going to found out. And that's the case with the SARS virus, the COVID-19 virus, that you're going to see when the literature finally starts out that those people that have gotten very sick have been the super spreaders, those people that have come into contact with people for extended periods of time, and the amount of virus exposure is much more significant than it would be when I go into a grocery store, for example, where you might have some contact with the virus, but it's such nominal that there's not going to be necessarily an onset of disease. And I come to this slide because I think it kind of reinforces and takes a little bit of the terror out of the COVID-19 disease, or at least the exposure. And then when you're starting dealing with infectious disease or such, you really want to know, are you at risk? And ironically, the PPP, which also stands for the Payroll Protection Program, but in this case, the PPP deals with risk management, and it stands for prolonged proximate patient contact. And when they talk about proximate, you're basically talking, this is where the 6 foot comes about, and that's the distance that typically you want to stay away from people when they cough and they sneeze. That this is the aerosol generating that people have heard about. And when you talk about shaking hands or touching items, there's a little bit of when you talk about shaking hands or touching items, this is where the aerosols would deposit themselves on surfaces, and that's where you could have some touch to your face, for example. There was a study one time that people normally will touch their face, and I can't tell you where the study came from, it's anecdotal, about 20 times an hour. So you don't think you're touching your face or touching your nose, you tend to do it on a constant basis. Prolonged is an important thing, because when you start dealing with exposure, you're talking about how long am I going to be in contact with the person that might be generating the viruses, okay? And it's a lot more than just a brief walk by or casual contact. And often it's a few minutes, 7 minutes, several minutes minimum before you're going to have any significant exposure to the virus. And the patient, one of the things is you're talking about the person who's actually sick. And I know that people say they're asymptomatic. Well, typically asymptomatic means they're not coughing or sneezing. And so they may have contact, they may have the virus, but they're not generating the aerosols that a person who is coughing and sneezing would do. Doesn't mean that it's not important to protect yourself, but when we're dealing with patients, we're not dealing with those people that have come into contact with these patients if they're not themselves sick with the COVID-19 disease. In the risk assessment, risk management business, it pretty much started with OSHA. And OSHA put together a good guidance document dealing with COVID-19. And their risk pyramid looks something like what you see on the screen. It's a pyramid. If you flip this upside down, you would have what is the crisis communication, where the lower risk, which is the most of us down there, it's been communicated it was very high. Well, that's not the case. This is actually the risk pyramid for COVID-19, and that OSHA, and again, this is the federal OSHA program, that basically saying there's not a lot of people that are very high when it comes to occupational risk. And the same thing with people who are high. Most of us are in the medium or lower risk levels. And when we talk about what does that mean, I would say that most of you who are listening here, unless you're, if you look at the two bottom bullets, unless you have a high exposure potential to sources of COVID-19, which is the disease, not the virus, or you have known sources of COVID-19, you would not be considered high or very high. And most of the people in the high or very high are those people in healthcare. You know, they are actually within 6 feet, and they're attending to people who are sick with COVID-19. The rest of us fall somewhere in the lower to medium level, where if you look at lower jobs that do not require contact with known or suspected infected with the virus, or you don't necessarily deal with the general public. And when you talk about close contact, we're talking about within 6 feet. That would be considered a lower risk category for workers. Medium, you may have close contact, and you may have to go within 6 feet. You know, these are potentially, if you look at the people at the grocery store, for example, they clearly are within 6 feet of people who are checking out. And even if you put a barrier right there and say, okay, let's consider that a medium risk category. The irony is, if you look at the OSHA classification, what do you do if you're medium? What do you do if you're lower? Neither one of them specified that you need to put a mask on for these people. It's only after it pretty much became a political, and it's probably not a bad idea, a political issue to say, okay, we're going to have mandatory masks. But from a risk standpoint, the original personal protective equipment had nothing to do with putting masks on if you were in a lower or medium level. Taking another step farther, right now I'm in the middle of putting together a quantitative assessment on how do you rank jobs and how do you rank industries, and when are we going to get people back to work, and what are we going to require when they go back to work. And this was a model that we're modifying. This actually came out of Wisconsin, and it's kind of a neat little aspect where it's really looking at developing risk scores for 4 different levels here. The first one is what I was talking about earlier, and that's the risk level associated with what OSHA is talking about: lower, medium, high, and very high. And what we're doing is we're taking the type of industry you're in, and we're deciding to assign a risk level depending on what your basic job is going to be. And basically what we're saying is those people that, we'll give an example, those people that are going to be cutting hair, for example, you're going to come within contact with people, you're going to be within 6 feet, and that would have a higher risk level than, say, a retail operation where you really don't have to come into contact with people. You're surely not going to touch them, okay? So we're arbitrarily putting together a risk classification by business sector. And the argument is open up the commerce. There's a lot of higher risk operations occurring today. And we'll go back to the grocery store example, than those businesses that are currently shut down. So it's kind of a point that we're going to give a relative ranking of various various business sectors. The other things that these risk scores are calculated, there's population density, which New Jersey is pretty high. Local infection rates, we got a lot of data on how we're going to measure that flattening of the curve. When you have, lesser and fewer of identified cases, for example. And the fourth is where does the healthcare system stand today versus last week and the week before in being able to handle further or increasing infection rates. And this has to be on how many ICU beds, how many ventilators, and so on. And the system, it mirrors what OSHA talks about: a lower risk, moderate risk, and substantial risk. And it is basically going to kind of drive what is going to be the requirements for people to not just get back to work, but also when people are going into places of commerce. Okay, if you go into a store, if you go to a restaurant, if you are trying to get customers, where is your risk going to be, moderate or lower or substantial? Here's an example of moderate, which is a lot of businesses right now based on it. And it requires, if you look at it, a personal protective equipment assessment. Okay, how do you make sure your workers that may never have used personal protective equipment prior to this COVID outbreak, but now we're going to have some PPE. We're going to have gloves and masks and so on. Cleaning is the next one. Numbers of people, density. The fourth bullet down, I guess it's the fifth bullet. Can you keep people out of the workplace? Modified work hours. and the whole issue of trying to regulate people coming into your area. So these are just examples that are coming out and trying to get guidance for people to come back to work. I'm going to talk a little bit about masks. Everybody's now in the mask business, so let me talk a little bit about science of masks. You've heard the term N95. N95 respirators have been around a long time. If you look at the second bullet right there, they are particulate respirators. They have a tight seal. And when I talk about tight seal, it requires or it assumes that you're clean shaven and that you've had some fit testing. And I have seen many, many people grab an N95 and put it on. Let's assume they put it on correctly. But for the most part, not everybody's clean shaven. And if you're not clean shaven, you might as well not even use the mask. It's going to really serve the same purpose as the first bullet, the surgical masks. And if you haven't been fit tested, this does not give you any insurance. And what fit testing basically is to just have a means to determine if there's leakage in the mask. And it's a teaching tool because people can adjust it, and you know, it's a process that needs to be done if indeed people want to have the maximum amount of protection on an N95. Most of us, though, are in the surgical mask business, which are cloth. I've seen these made from home. I've seen the surgical mask. I've seen a whole bunch of different things. And basically, they're not particulate respirators. What they're doing is protecting people from you. And that's why they're looking at universal requirements in grocery stores and things like this, different places. And you're going to see these as being a requirement as this economy gets back into running again, that people are going to be wearing masks because that will reduce the amount of aerosol. And if you remember the triple P I talked about, proximity and such, that you're going to reduce the opportunity for these viruses to remain in the air around you because you're going to contain those within these masks. So that's the main difference. I do talk a little bit about N95. These slides will be available afterwards, so you can kind of look at them a little bit more. But it doesn't necessarily. One of the things about an N95, it doesn't protect you 100%. And this gets back to our dose discussion, in that protecting you in high percentage levels from any sort of exposure to particulates or potentially from viruses, and this does protect you from the viruses, the size of particles. You still have an opportunity to get some exposure, and that's not necessarily a bad thing, okay? Because as I said earlier, you do need to have a significant exposure in order to onset disease. One area for those people that operate businesses, when you start looking at respirators and you start looking at requiring people to put on different types of personal protective equipment, if the employer requires that kicks in a lot of safety requirements under OSHA. Mandatory use requires that you have a complete respiratory protection program if you're using an N95 mask, which means you have to have a medical evaluation, you have to be fit tested. So be careful when you start looking at what is mandatory versus what is voluntary. And it's a fine line because the state is mandating use of respiratory protection, but does that necessarily mean that the employer is mandating use and therefore has to kick in the requirements of OSHA? My opinion would be no, but it's just an point that when you put your program together. The other thing that's important for those who are operating businesses or involved is recording workplace exposures. And when you're dealing with someone who has a COVID, has been diagnosed as positive or is sick as a result and symptomatic of COVID-19, the question is this a recordable illness? You've heard about, again, grocery store people that have been sick and other people. And my position, and it's been supported by by some of the guidance documents out there that if you're in an industry that is considered low or moderate risk, not high and very high, the healthcare, if people get sick in this industry, it's not, you can treat it mostly like if people had the flu and was off from work. And maybe you gave other people the flu when you were at work. In this case, it would not be a work-related exposure, or at least a work-related illness, and therefore it would not be required to be recorded as an incident, and therefore potentially be a workers' comp issue. So let me get some basic action items as part of your return to work program. The first thing I would do as part of your return to work program is take a risk-based approach and making sure that people understand what their work functions are, how employees are classified, and that we're not dealing with high or very high, except for those of you that might be in the healthcare business, you know, and then you have to be careful. Not every job in healthcare is going to be considered high or very high. But when you take a risk-based approach to what you're doing, it's a much easier program on when you start looking at being prescriptive of what is required for each person at the risk level, which is your third bullet there. I have the second bullet is a three-phased approach in trying to get back to work. The first phase is probably the most stringent when you start looking at work practices, cleaning of facilities, making sure people have opportunities to wash their hands. You might provide them with wipes and Purell and other ways. So it is very, you know, the vigilance level is very high. You can start looking at, when I talk about work clothing and segregation of work clothing, keeping work clothing from not necessarily going home with you. You know, if you have a way to change your clothes or you have a coverall on, we're not promoting the use of Tyvek, even with people cleaning. Though they may use it for a couple of reasons. One, it's overkill with regards to the protection of the person. Plus, it's very difficult, and the availability of PPE, which is the fifth bullet right there, is not very good right now. So it's very difficult to get disposable clothing because there's such a run on it for everybody else. So it's not important that it has to be disposable, but it's not a bad practice. And the last bullet in being prescriptive is make sure people self-report that if you are sick, if you have symptoms, you might have some sort of gatekeeping operation and taking people's temperatures. You know, this is all part of your risk management program. So your action items and what everybody is going to do and needs to do to get back to work is you really got to put together this return to work, that we call the return to work COVID-19 health and safety program, which outlines the risk classifications, which outlines prescriptive on what you're necessarily going to require people to do. There's certain policies that you want to make sure as a company you have. The work from home policy, I think people have already established quite a bit of that at this point. You want to make sure you have a reporting policy, and it gets involved with, you know, can you ask people if they have been designated or have been shown to be positive for COVID-19? And the answer from what I've been hearing is yes. You want to make sure that you have procedures on why people can and cannot self-quarantine. Record keeping we talked about. So these are all policies I think are very important to pull together. And the risk communication is very, very important because people are scared out there. People want to have confidence. So you want to have communication from your leadership. Again, you want to talk about the concept of risk. You want to make sure everybody understands why the protocols are in place. And I think people are ready to pretty much do anything you ask them to do. And also reinforce that some of your biggest exposures is when you walk out the door and go home and go to various other places. So you want to make sure you continue those best practices. The last couple slides, I'm just going to touch on cleaning and disinfecting, just so people understand that when you're dealing with a virus, It's a fragile in the environment. It is fragile, but it can, if you look at survive, it says you can go up to 72 hours on plastic. The good news about some of these materials like plastic and some of the steel and things like this, they're easy to clean. And so you want to make sure that you have a cleaning process with detergents that can melt fat. And you also want to make sure alcohol, we're talking about alcohol at 65%. This is common things. And if you want to look for the disinfectants, there's a big list of what is approved and what is accepted. And they call it the EPA List N for disinfectants. You can Google that and come right up. Steps to clean. One of the processes we have is waiting. The virus isn't going to survive over time. So if you don't have to go into an area, and we were doing this for healthcare rooms and hotel rooms where you just don't clean them for 2 days or 3 days. And then you can go in and clean. And the time itself can help you kill the viruses that are in there. And you can see the process, remove the soil, disinfection, wipe surfaces, disinfectant fabrics. The last slide I have here is that if you're hiring cleaning operations, one of the things you want to be sure to be aware, we call it caveat emptor, as buyer beware, is that everybody's getting into this business right now. So you want to make sure that if you have a cleaning service, it doesn't have to necessarily be a service that has anything special with regards to how they clean, as long as they use the disinfectants we talked about. But make sure they're in compliance with the health and safety requirements, that they have some training using personal protective equipment, that they have the right equipment, and that when I say rushed, there's a lot of people who just got hired. So we want to make sure that you have some quality assurance to make sure that they do their job. And it's very important to have some management system and oversight so they do their job according to the specifications. You have a checklist, a quality assurance that somebody says they've done it correctly, and there is some final report. So that's the presentation. I can go back to questions.
Okay, Bruce, thank you very much. That was very, very informative. Lots of things to consider. Our first question is on taking temperatures. The person who wrote this said, we're taking temperatures of all staff as they come to work. If above a set number, we're sending them home. This seems like a good place to start. What are your thoughts on that philosophy, and what might you comment to this person?
From my experience, it's right now, remember I talked about phase 1, phase 2, phase 3. Phase 1, we're, I wouldn't say it's overkill at this point, but you want to take a vigilant approach. And what temperature taking does, you're a gatekeeper. People will come in, you'll take their temperature. You also often ask them 2 questions. Okay, have you anybody been sick in your home? Do you have any symptoms? And that's called self-reporting. The temperature taking is, from a quality standpoint, what happens from our experience, and we have people taking temperatures for various companies, is that you often want to put them to the side if indeed they have an elevated temperature, and then you can retake them, because it could be that they were, especially as the weather gets warmer and everything else, that it is not related to somebody who has gotten sick. But if you have someone who has a high temperature, above what normal temperature, around 99 degrees, it's not a practice to say, look, this is our policy. We're not going to allow you to come to work. And you may be, a good time to determine whether or not you have to seek some sort of telemedicine situation to talk about if they have any symptoms.
Okay, thank you. The next question is, we're not planning to bring anybody back until September. How should we think about these risk assessments, given that we're not even contemplating coming back to the workplace until at least the fall?
Well, if you remember my 4 levels of criteria in the risk assessments, which are going to be next week or two, you're going to see that the job itself is going to change. So that either you have a risk that you're going to be contacting people or not contacting people and such. But what you're going to see, hopefully by September, the onset of disease is, if it's not at that point, it's going to be very, very low. You're going to have hospitals and healthcare facilities that are back on their feet, that are very much, back to normal. And so from a risk standpoint, you're going to be beyond stage 1, what I talked about, where there's moderate risk, and probably a lot of those risks are going to be minimal risk, and which could be defined as still keeping distance, social distancing, some use of surgical type masks, maybe segregation, depending on how you want to design your company. And that's important. You want to design it so it makes sense. There's a human factors part. But September, the risk levels should be quite low, hopefully. And people are going to be watching whether there's going to be that rebound everybody talks about. But I would say it's a good opportunity to learn from a lot of people that are getting back to work in June to see what worked and what didn't.
Okay. All right. This question is about the Wisconsin risk score. How large an area do they consider to be local? Because for New Jersey, we have many employees who travel more than an hour distance, so the virus may be more virulent in Central Jersey, for example, or there may be more liberal policies about coming out in Pennsylvania. So what should be, is there anything that should be considered if you do know that your employee base comes from a distance?
Yeah, that's a great question, actually. The fact is, New Jersey is not Wisconsin, and they start looking at densities, and density in Wisconsin is defined as a low density of 250, and then they go 250 to 500 to 500 to 750. That's people per square mile. Well, New Jersey starts over 1,000. So when we start looking at density, that's going to drive the risk up higher than it would in Wisconsin. But the corollary to this, our care system is much more dense also. So you've got 2 different factors here. And so you are going to recognize, and this is where the gatekeepers come in, that if you know people are from an area where the disease levels, the onset of diseases are much higher, this is where you can be a gatekeeper and say, look, we do want to take your temperature, we do want to have you self-report, and try to control from a mismanagement standpoint that part of your job as much as you can. You still are going to have good practices. I mean, people in the workplace have been using personal protective equipment and going through the vigilance of personal hygiene forever. Now you just have a whole different potential source, this infectious source, that you just have to manage that also. So.
If you are interested in doing a very thorough cleaning of your workspace before you have anybody return, what would you look for in a cleaning service to come in and do that for you? And or should that be the responsibility, or could it be the responsibility of landlords to just make sure that the whole building is cleaned if it's a multi-tenanted building?
Well, cleaning, in this case, this is not cleaning of a contaminated site as it would be if it was a flood, or if there was lots of mold, or if there was some sort of chemical contamination, asbestos. I mean, there's all sorts of things where cleaning can be very, very exotic. In this case, you're basically doing good old-fashioned cleaning and disinfecting, which everybody does at home. So you want to have a procedure. And what I recommend to people is, you don't have to get a high-end cleaning service that people are going to, treat it as being some sort of awful thing for cleaning. It can be basic janitorial services, a little on steroids in that they're prepared to use personal protective equipment. They're prepared to make sure they don't cross-contaminate. They do a job very, very well, and you have some sort of procedure and someone providing oversight to make sure they've done their job. And that's part of the documentation, because you're going to have to convince people that it's safe to come back into the building. When I was, after 9/11, one of the things I did quite a bit is to get people back into those that are downtown Manhattan. And they were perfectly safe. Even some of these buildings were impacted by the towers going down, and they had, all sorts of potential issues that were in the buildings. The buildings were clean, everything was safe, the ventilation system was safe. But I wanted to make sure that people were comfortable in knowing that's the case, and with good scientific information that tells them it's safe to come in this building. And that's going to be the same thing. It's going to be a little less complicated than it was back then, but it's still important, I think, to make sure that the process was going. Whether the landlord does it and does a cleaning, or the tenant does it, that's really a case-by-case basis. If I'm the tenant, I would like the landlord to pay for it, and so on, but that's something you have to negotiate.
Mm-hmm. Okay. Another question is that, and this probably is applicable to a number of our members, some of whom are nonprofits, and they might have a smaller staff, but they have many clients, visitors, business partners that are coming in and out of their office. And this question is asking, should they be made to comply with your office policies, even if they may find it off-putting? If your office policies are more stringent than whatever their own business is requiring, how do you handle enforcing whatever it is you feel is important to your safety?
That's a good question. I never thought I would walk through a grocery store with 100% of the people wearing a mask. Okay, we're in a different time right now. So when you deal with trying to sell a process and a program, you want to have a receptive audience to be willing to understand what needs to be done and make sure that it's practical for what they're doing. And so in this case, part of the process, and this is where I talk about stage 1, stage 2, stage 3. Well, we're talking about stage 1. And you're going to have to let people know right away as they come into the office, these are our procedures because we're returning to work after this crisis. And it could be that they're going to get their temperatures taken. They're going to be asked questions. They're going to have to wear a mask. They're going to have to, whatever your procedures happen to be, whatever makes sense. And my experience so far is people are willing to grab that right now because they're concerned about their own exposure as a result of them being an exposure threat to someone else. So it becomes, if you remember in the presentation, I talk about a return to work program. Part of the program is you have someone who's responsible for that program, some way to make sure it's being done, and you implement the program you would if you walked into a power plant, or if you walk into a manufacturing operation. There's a whole bunch of requirements that people would have in wearing personal protective equipment and making sure that they're not chewing gum, or whatever the process happens to be. But my experience is that people are going to be inconvenienced, but I don't see that in phase 1 you're going to have a lot of non-compliance with people if you are clear on requirements are. And if they need to know why, then you can tell them why. But I think most people understand what the purpose is in trying to implement some of these programs that really haven't been the norm in the past.
Okay. Another question is on exposure, and you talked about the different levels of risk. depending upon the length of time that you're exposed. Let's say that you're in a grocery store and the person waiting on you, the clerk at the checkout, is asymptomatic but has the virus. But you're only exposed to them for the 3 minutes it takes to check out. And you're not even handing them your credit card because you're using the machine to do that. So what's the level of exposure, or even in that circumstance that someone else has been using the panel to enter their credit card information? What's the exposure, there? Is it relatively low risk compared to some other things?
The answer it is relatively low risk. You now have a checkout person that has a mask. You have surfaces that you can touch, but what I would say is that when you go into the public and your surfaces in touch, this is the opportunity for you to wash your hands when you're to think about that you're trying to control exposure and you're not touching your face at that point. Now, of course, you're wearing a mask, which is a physical barrier to you touching your mouth and nose and such like this. So you got a whole bunch of these steps, which the whole purpose of these steps is to reduce proximity, to reduce the chance of getting any significant exposure to any viruses. And it works very well. You see people who are uncomfortable with people who are not necessarily wearing a mask. There's a lot of people who are talking are not used to wearing a mask, so they'll slip it down and everything else. And the natural reaction to people when that happens is to start stepping backwards, okay? It's interesting, you can do a little social experiment on this stuff. This has been my life in trying to how do people handle personal protective equipment. As they get trained, they get used to it, the compliance is improving. But I would say the chances of exposure, if you're being responsible and you're washing your hands and you have a mask, the chance of any exposure in a commercial setting is very, very low.
Mm-hmm. Okay. I'm going to go to one more question, and then I'm going to turn it to Chip, and just say that if other people have questions, we will be, Bruce, I don't know to what extent you're willing to share your information and be able to answer people's questions after this forum. But we can at least be fielding questions to you if other people have questions. But the last one, I think, does, especially in a city like Newark, where a lot of people do use mass transportation compared to some of the more suburban locations. To what degree, how do you handle your employees who have to travel on public transport? What are the expectations for them in terms of them potentially being exposed to greater risk because they're on mass transit?
Well, that's a good question. And, somebody asked me, he said, would you be willing to fly an airplane? The answer is yes, especially if it goes to a nice place. Because you now have people who realize what the exposure is, and everyone's wearing masks at this point. You start dealing with being able to, those touch points that you can touch, which typically are going to be stuff there anyway in a bus, is that you try to keep some distance from people if you can, and you basically want to make sure that when you get off the bus and you get off the train that you do wash your hands, and I've had people wash their hands, they wash their face a little bit, and reduce any real exposure potential in these kind of mass transit situations. So we also have been working with New Jersey Transit, and they are in a very vigilant process of cleaning buses and trains. And we've done the quality assurance, we've reviewed this, we've inspected these things. So these buses are going through major cleaning every night. So it's that phase one in that you're responsible for protecting yourself, using some of the items that we've talked about and distancing yourself or wearing a mask and washing your hands. And if you do and you're vigilant in that situation, and your chances of exposure of significance is very, very low.
Okay. Actually, I'm just going to ask one more that came in. If somebody in your office is identified and lets you know that they have been diagnosed with COVID, what sorts of things do you need to communicate to the rest of the team to let them know that they potentially have been exposed, and what else do you need to do?
Yeah, I mean, that's an interesting question of making sure that you communicate to your employees on what is actually occurring, and you also don't want to tread on any sort of requirements that you have to keep confidential people's medical condition. And I don't know if I have a real good legal answer on this. Okay, so I'll put the caveat that that's still coming out. What I'm seeing are people saying that it's important from a tracing standpoint to let people know that there was someone who was diagnosed, or I should say tested positive for COVID-19. That at least allows people to, the company that typically does something about that. I mean, this is part of your return to work program, your health and safety program. It might be that they've cleaned that area. I've seen that. It might be that they've let everyone know. They've shut down operations if there's multiple people that have tested positive. So whatever your process, it should be a policy like anything else. It's not done on the fly. It says, if this happens, this is what we're going to do. We're going to inform people. As you start getting into stage 1 and stage 2, you're finding companies are not shutting down as a result of this. They're letting people know what are the symptoms, and if you're symptomatic, if you want to get tested, that this will be something that hopefully will be a little bit more prevalent, that you'll be able to test people who may have been in that same area. But this is something I would recommend companies to think through and to make sure that you have your ducks in order. So when this occurs, you're not just scratching your head and saying, oh, geez, what should we do?
Okay. All right. I'm going to turn this back to Chip. And thank you, Bruce. This has been very informative.
Bruce, thank you very much for sharing with us this morning. You know, the practical advice you offered for risk-based approach to all this is very, very calming and reassuring that if we take the right steps, we can protect our employees and return them to work in a very safe environment. So we really appreciate your sharing all that information with us this morning, and making the presentation available later for everybody to have. That checklist is terrific. So thank you very much. With that, I want to remind everybody, as Barbara did at the beginning of the call, we have two more webinars so far scheduled in this series, talking Monday about social distancing and the employee mindset and behavioral aspects of returning to work. Later today, or excuse me, on tomorrow, we hope you'll join us for one of two or both networking opportunities. We have our NRBP Nexus small group networking tomorrow afternoon, and then later in the day we have our NRBP happy hour. So we'd love to have you join us for one or both of those. Meet some other people, take a break, have your favorite beverage with us tomorrow at happy hour, and kick back a little bit. Also, would like to tell you that on Friday at 12:15, in cooperation with the Meadowlands Chamber, we are hosting a call with Senator Cory Booker to talk about the federal response to COVID-19. So if you're interested in joining that call, you can go to our website and sign up for that. Another opportunity to get a little bit more information about what's going on. So with that, it's time for everybody to get back to work. Bruce, thank you again very much for joining us.
My pleasure.
To all, we look forward to having you involved in further activities, and we wish you all to be safe, stay healthy. Thank you.